the meeting for the Finance Committee, and first thing on the agenda is public comment. Do we have any public comment? No. Okay. All right. So the next thing on the agenda is approval of the minutes. Has everybody had a chance to review the minutes? Are there any additions or corrections to the minutes?
Move approval as issued.
Second.
Okay, moved and seconded. All in favor?
Aye.
Aye.
Okay, passes unanimously. Thank you. All right. So, how do I pronounce this name? Giro
French.
Hiro, Hastus Maintenance and Support.
It's French, not Greek.
Okay. All right.
Phil, I would like to introduce Phil. He's our interim IT director.
Okay. All right, good.
Good morning. Thanks for a nice introduction, Brad. As Brad mentioned, my name is Phil Gao. I'm an interim director of IT. This is an action item to recommend approval of a 3-year software support and maintenance agreement with Jero. HASS has been PSTA's robust software backbone of route scheduling and staff timekeeping software used for schedule building, operator one cutting, operator bidding, and daily scheduling within planning and transportation departments for more than 2 decades. Back in March 2016, last year, the board approved a major upgrade to the 2016 version of Estes. The upgrade is an integral component for PSTA real-time data management software, Collaborative Works. The award for the upgrade did not include any maintenance and support for the software after the upgrade was accepted by PSTA. We expect to accept the upgrade within the next 2 months. There's a cost of $376,000 for a 3-year of routine maintenance and support on HASTAS. Each year includes 5 maintenance days that can be used for on-site visits, for training or modification if needed. This software maintenance funding is budgeted each year in the PSTA operating budget. Again, the action item is to recommend approval of the 3-year agreement for software support and maintenance with Jero, not to exceed cost of $376,000.
Right, Bill, can you take a minute and just, because we have some new members, can you take a minute and give us a quick summary of what HASTAS suite actually does and where it occupies an important part of what we do?
Well, again, HASTAS is a backbone component used by transportation and planning. It's a scheduling. It's used for route scheduling and staff timekeeping.
Okay. Does it tie in with, like, for instance, the real-time software that people use to check on when a bus is coming and that kind of thing?
It will be integrated with Clever Devices, which is by it's called Clever Works. So the data from HASS will feed into the Clever Works to provide the real-time information.
Okay. All right. Now, and we've used this vendor in the past. Is that right?
We did purchase this back in 2016. Did the upgrade.
Okay.
Yes.
All right.
We've had HASTAS as our scheduling software for more than 20 years.
Okay. All right. And they're like the leader in this sort of category of services.
There's basically two companies that every system in North America has, either HASTAS or North America. And when they both got started in 1970s, everyone picked one or the other, and then they pretty much got you.
You're sort of stuck with it, right?
Yeah. But at least, in my opinion, talking to scheduling people, of course, most of the places I've worked are Hastis, although I've worked at trapeze places too, and Hastis is better.
Okay, all right, good. All right, anybody have any questions? Yeah. Oh, go ahead. Sorry.
That's okay. So this is software maintenance agreement, correct?
Yes, it is.
Okay. What kind of maintenance do we expect, or what kind of maintenance does this actually cover with the software? Is it changes to the software? Is our needs change? You know, I'm trying to understand what they're doing each year for, you know, $100,000 each year.
Well, there's a big jump. We upgraded from 2010 up to 2016, and they have a new version every year. So we have a big jump, and so there's a lot of enhancement to the software, and also the reason why it's cost a little bit higher is because of inflation also.
Yeah, but what are they actually doing with the, you know, so we have a maintenance contract. What are they going to be maintaining? What needs to be changed? I realize that we upgraded the software in 2016.
Yeah.
And they supported that in 2016.
You know, there are some kind of issue with software, server issues, errors on the by user that will support a free support. You know, for free support. I mean, we pay for the support, like in case there's any issue with the server crash, or client's desktop size crash.
Do we have any experience as to what sort of maintenance requirements we've had in the past? You know, how many times we've called, or how many times they've been on site to service? Right, because we said we've been using this company for a while.
Yeah.
Is there any sense of what the history has been?
We could probably pull that. I mean, I know it is.
I mean, did you hear all the
Often.
time, or
It's all the
I have no
time.
idea. That's what.
I would say it's generally all the time. There's constantly, every single day at PSTA, this HASIS program is used by multiple people. It is where all the schedules, the entire operation lies within this program. It governs payroll. Lots of the issues often are with the integration, because it integrates with payroll, with the real time, with all the information that the customers see, with the printed schedules, and you know, when any of those other software programs upgrade, then there's always problems. And what Phil mentioned was, one of the things that is definitely paid for is the what's it called? Is it 5 days?
Or five maintenance days.
5 maintenance days, which basically is them coming here, and they can do training.
They come in
or
here, yeah, you use that
major
for
upgrades.
training, or if there's any modification in the software that needs to be integrated with the other software, for example, clever devices.
Okay, thank you.
Thanks. Commissioner Scott?
Thank you, Mr. Chairman. So, last year we upgraded. So did we not have a maintenance agreement at that point? I mean, was that an upgrade because we did not have a maintenance agreement in place?
It did not include it when we did the upgrade.
But we did have a maintenance agreement. We've always had a maintenance agreement, and we budget that every year in the budget. And then it went up to this amount last year.
With the new version?
With the new version, yeah.
So does this include future updates, or are we will there be a, you know, I don't know how often they come out with major updates, but the next major update, say in 2020 or 2021, is it going to be?
If I could, software agreements, maintenance agreements, this is where they get you on every software package. You probably know that from your business. You pay for it once, and then every year you've got this maintenance agreement.
Right.
And to your point, you know, things may break, they may need patches, or you may have nothing. It's almost like an insurance agreement. So let's just say in 2020, there's a major upgrade. Every year between now, let's say, for instance, 2020, there will be minor upgrades that this will cover.
Okay.
So that will increase, and then when we do this again in 2020, we'll still have a maintenance agreement, but it may be at a different amount at that point in time. But by doing this for 3 years, at least we're locking ourselves in to keep the cost steady.
Right. So do you think in 2020 there's going to be another big spend upgrade, or do you think this will, or will it just be a roll into another maintenance agreement
Usually,
excluded?
it's like, this was from 2010 to 2016, which is good. Normally, major software programs upgrade about every 3 years, and you have to pay several $100,000 just for that upgrade. and then you have to do the new maintenance agreement on top of that. We do have in the 5-year capital plan the anticipation of looking at some additional modules for the HASTA system. I think that's in 2019.
What would those modules be?
You know, off the top of my head, I don't recall what they are, but they would be for efficiencies. You know? Oh, okay.
So this is a software package that my department uses, and it keeps our numbers for the number of personnel we have in the department down. So, you use this kind of software package to, instead of having 10 schedulers, we have 2 right now in the vacancy. We could probably use another one, but the module that we're looking for would help with rostering as well as the bid itself. So right now we're doing a hand bid, and a lot of the supervisors take their time to go through with the operators and do the bid. So one of the modules we're looking for is to do it all online.
So now it's the manual process versus the...
Right.
Mr. Johnson?
I have to ask, operator run cutting, that's probably not what it sounds like. That we're cutting our employees with a knife. What is run cutting?
Well, I think the word cut refers to, you take the total PSTA schedule of bus routes and how often they come throughout the whole system, you sum it all together, and then you cut it into 40-hour pieces of work for drivers. So a driver may not ride, a route may not have 40 hours up and back all day. They may drive the Route 4, then the 52 for one leg, and then some other route, and then the system magically figures out the most optimal computation of how to cut all the runs together for the least amount of employees, or you put all your parameters in there. You put your union rules on breaks or layover and stuff like that, and then it figures it all out, theoretically.
So this is between 4 in the morning when the first people report to midnight when the last bus pulls into the barn.
Yeah.
It's scheduling all that. We don't have 8-hour days and 40-hour and 5 days a week, so, okay. Sounds like this is really pretty important and fairly complex to...
It is. I mean, as Cassandra said, it's used by her department every day. We change the schedules 3 times a year on a certain day, and those days are major days for PSTA. Even if the routes, even if the customer doesn't see any change, the drivers, per our union agreement, get to rebid based on seniority what they want to drive. And so prior to that day, there's a whole schedule of months of planning, of first designing any changes to the routes, then putting it into this system, and then there's about weekly or bi-weekly meetings with the union representatives that James enjoys, and where they complain if the Sanders people have messed around with their perfect thing that they like, or whatever, and that goes on, and then the system is used again to run the bid, which the bid is when the most senior driver gets to bid first, second, third, fourth. All that happens before the start date and then it starts all over again for the next 4 months.
Mr. Chairman, I would move to approval of the agenda item.
Okay. Let me ask our newest member, do you have any questions?
Yes,
By the way, introduce yourself to everybody.
Richard Bennett's my name, okay? Thank you for asking. I see the physical impact is $376,000. Is that the correct amount of what this is going to cost us?
Yes, for 3 years.
And is that in the budget already?
It is.
Okay, that's all, thank you.
Okay, so we have a move, do we have a second?
Second.
Okay, Commissioner Schulman will second, okay. All in favor?
Aye.
Okay, opposed, nobody, so passes unanimously. Thank you very much. Okay, Next on our roster is Henry talking about something that Brad, Henry, and I have talked about on several occasions, and that's bus shelters.
Yeah, and Mr. Chair, I'll take this with Henry as my very strong backup. But just back on the Giroux-Hastis, would that be okay by the committee's pleasure to put on to the
Yes.
consent agenda?
I think that's consent, it's routine, right?
Okay.
A lot of good questions, though, thank you.
Yeah, it was. So I think you probably know this, but on every action item, every contract that PSTA issues, we put up into the gray box at the top of the summary sheet the action item. And in those, we always include a not to exceed time and not to exceed money value of every contract. So we typically have most of our contracts either 3 or 5 years service kind of contracts, or in this example, bus shelters. This is a 5-year contract, and we do a procurement, and then the finance committee reviews it, and then it goes to the PSTA board and approves it for a set amount of time or a set amount of money. The action item today is to increase the value of existing contracts. It's not to award a new contract to new vendors. It is just to increase the value to Brasco, which is the manufacturer of our shelters, and to Certus, which is the installing company and the one that pours the concrete pads for shelters. So it's not necessarily changing the shelter program. The reason that we would like to increase the value, ask the board to increase the value of those 2 contracts is because we've been very successful in our shelter match program. PSTA staff usually try to set the value of contracts related to what's available in our budget. And we did that in this case. We set the value back in 2015 when we approved these contracts. We set the value of them equal to the 5 years in our CIP of how many bus shelters we could afford to buy and replace. And so in total, in 2015, the board approved a $1.1 million, not to exceed $1.1 million over the 5 years. We're just entering year 3 of the bus shelter contract, and we're almost to the $1.1 million, not because PSTA has overspent or spent faster. We're still right on pace with our CIP, but cities around Pinellas County are buying off our contract through our shelter match program, where we offer, with any city that wants to, or the county, a 50-50 deal that we will match other people's money, a city, if they want to build a special shelter or a regular shelter, they can do that. And we've been very successful with that. Madeira Beach, Dunedin, St. Petersburg, and others have already bought shelters off this contract. It hasn't cost PSTA any extra dollars, but it's eaten up some of the value of the Brasco contracts. So in order to keep going, with the program, recommending an increase to the shelter contract of $1 million. So instead of 1.1, it would go to 2.1, 2.148, and then increasing the installation contract, the concrete one, by $750K to go up to 1.125. We're not recommending changing the amounts in the CIP. PSTA will still stay on course with spending the money that it's planning, but we're putting room in there because we know of some cities' intent to buy off this contract through our match program, and so we're just putting that room in there.
Has Gulf Corp come in yet for their completion on what they're going to be doing?
They have not.
Okay.
I mean, but they're another one that we've talked a lot to,
Yeah.
and they've expressed interest.
Right. Okay. Questions? Yes, Commissioner Scott.
Thank you, Mr. Chairman. Brad, how does the money flow in that situation? Let's say Madeira Beach wants to, do the 50-50 match on half a dozen shelters. Do they pay PSTA that 50%, and then PSTA cuts the check to Brasco, or does the city
Yes,
may have?
what we do, that's why we need to increase it to this extent, is we go ahead and because the contract is with us, we place the order. Essentially, we get community support money in to reimburse what's been spent.
So we invoice Madeira Beach, they pay us, and then we pay. Okay, got it. Right. Okay, thank you.
Anyone else? Yeah, Mr. Schulman.
Thank you, Mr. Chair. So if we vote to increase the contract by $1 million, with the expectation that there's going to be matching from municipalities, say there's only $300,000 in matching, right? So we put in $300,000, the county's added $300,000, but we've authorized up to $1 million. So would we then stop there at $600,000 of shelter, or will we continue going out of the PSTA budget up to the $1 million?
Well, with the adopted CIP, we would just stop there, and we'd hit the 5 years. We'd probably hit the 5-year mark, and we'd only spend $300K, and then we would we'd do a new procurement,
Okay.
and start over again. So I mean, this is not actually spending any money; it's just authorizing up to $1 million.
Right, and I realize it's not to exceed that amount, not that it will equal that amount.
Yeah, hopefully it won't. Hopefully it'll be just under.
Is there any way to work in language regarding the matching, as far as the agreement, up to $1 million, expecting, a match with municipalities? Is that?
I mean, we could include that as part of the resolution, assuming supporting the PSTA shelter match program.
I think that might be beneficial so that people know that this is part of a cooperative with other municipalities to make that happen, not a solitary budget item.
Yeah.
Any other questions? I have a question. How are we advertising, getting the word out to the municipalities that they serve through this program? Because this is a really good program that some people, when we talk to different administrations, Brad and I just went around to the 6 cities I represent, and a lot of them are not really aware of this and the benefits that they could provide. We've all seen people standing in the sun, standing in the rain, whatever. We've all seen shelters that look a little bit dilapidated, maybe going to be upgraded. So how do we get the word out? This is a very good program, and it helps the ridership, and it enhances the beautification of the various municipalities that it serves.
Yeah, I mean, our magical tour of the 6 cities did impress on me that we do need to keep reminding cities that we have this program, although we certainly have had a lot of interest and still have a lot of interest. But
What happens is, I think some cities jump in with both feet and some cities don't do anything. So we need to make sure that everybody's aware of it and it's available in any city, in Pinellas County, and we need, except the ones we don't serve. But we need to make sure that everybody's aware of it and they can take advantage of it. It would help them. Okay, yeah, go ahead.
Does the municipality that's sharing part of the cost, do they get any say into specifications or what goes in or on a shelter, or is it really just they're writing a check and then everything falls under the contract?
they get a say, and they can design the shelter however they want. They pay. The 50-50 deal only applies to the equivalent amount of money as a regular shelter. So any fancy upgrades that a city might want that cost more than the regular base shelter, they pay 100% of those.
Okay.
Okay. All right, any other questions? Do I hear a motion?
I would move approval for consent agenda.
Second?
Okay. Motion and a second. All in favor?
Aye.
Yeah, I agree. I think consent's fine for this. This is routine.
Although being on the consent agenda also doesn't make it as visible if you're interested in getting it out to other members of the committee and spreading the word, putting it on at least as a quick item would at least help raise that awareness.
Well, that's true to some extent, but and we can move it to the regular agenda if you wish. But the fact is, it's got to be, the decisions to do this is done by the local council or commission. So not all cities are represented on the
No, I get
PSTA
it.
board.
No, I get it.
Yeah. So-
I'm not too worried about the cities that are represented on the PSTA board. I
Yeah.
think they're
Okay.
all working on it.
Yeah.
Okay.
It's kind of the
Good.
other ones.
All right, so now we come to the fun stuff. Okay, Deborah, tell us about, sorry about that. Deb, tell us about the situation we have with our health insurance.
For the record, you can call me anything you want, just don't call me late for dinner.
Okay, and I apologize.
No worries, no worries. It seems like it was, gosh, it was only 3 weeks ago, we were talking about health insurance as part of the budget presentation at the board.
And we loved it then, too.
And you loved it then, too. Well, that's good. It was one of our challenges that we talked about in addition to the property tax exemption increase. And since then, we've listened to you and we've met with the union. I'm sorry Rick Smith is not here today. He's the chief of staff for the SEIU. We've spent a lot of time with the union membership, which is about 80% of our employees, coming up with ideas. They've come up with great suggestions as to how we can help lower our costs. And this is something, it's such a sensitive topic because it affects every single employee, the choices they have to make, and the decisions that go into this. So today we're going to talk a little bit about what our claims history has been, which you've heard me talk about before, how the renewals came in, the options we're going to look at, and education and different steps going forward. I also want to introduce Sean Fleming from the Gehring Group. The Gehring Group is our broker that helps us through this process. He is the one who whips our different insurance companies into shape as we go through it. I think I have talked to Sean every single day in the last 3 weeks, including weekends. And he's saying, but Debbie, I'm putting my child down. I'm like, okay, call me later. But, you know, it's been a busy, busy time. Over the last 2 years, we have seen a huge increase in our expenses, and on a per employee basis, we've seen a 91% increase in the cost of the claims. We've had a lot of extraordinary claims, we've had a lot of conditions, whether it be diabetes, heart disease, et cetera, that are sort of traditional things that have caused this to go up. The actual costs last year were $8.17 million. PSTA through the minimum premium was capped at the $6.15 million, but it gives you an idea of where the mindset of the insurance companies are when they're looking at renewals. So we put out the RFP. We wanted to see where things would be as is, leaving it just the same. We had 3 respondents. We had Cigna, United Healthcare, and Florida Blue. You can see highlighted in yellow that Cigna came in at the lowest initial at $8.15 million, $200,000 less than what they've actually spent this past year. So for the past 2 years, they've spent way more than we have paid them. And the other 2 were just completely out of the ballpark, so we didn't even consider those. Let me just go back. You can see then Cigna here, which was the lowest one, 32.6% increase. Huge, all the way up to 85%. So there are a lot of considerations seeing what those numbers were that we took into consideration. Number 1, our union contract, as well as all our administrative employees, split the cost currently 50%, the increase in the cost of the health insurance. That puts us at risk with the Affordable Health Care Act of having our employees be able to afford what we're putting before them. A lot of our operators are probably in the $35,000 range, so this would have a significant negative impact on them. So we also want to stay competitive in the marketplace. We talked about that a little bit last month. All government entities tend to draw people to them because of the benefits we offer, whether it's retirement benefits, health insurance benefits, and the fact that we are able to service the community. So we had to look at other options. We spent, as I mentioned, a lot of time with SEIU. I give them a ton of credit. They gave us a lot of ideas to look at. We've looked at a lot of them. We're incorporating, one of the ones they really pushed, which we also heard from board members, was a multi-tiered approach. Other ideas that they had we're still looking into because This is going to be a continuum of ideas that you bring to us and others bring to us to be able to make this more affordable for not only the agency, but more importantly, the employees. So for the first time ever, I think we're offering 3 tiers. Many years ago, as I understand, I think we offered 2 at one time. You can't really read this up here. It's not a test for the vision chart, but you've got it in front of you. So we'll be offering several options here, and I will go through all of them. The one that we won't talk about a whole lot is the option to renew as is, because it goes up significantly for the employees from $23 to $66 a pay period. So let's take a look at option number 2. This is where we're coming in at competitive rates to the other government agencies in the other area. And we're looking at capping out the employee at $29 and the family at $272, and then sort of balancing in between. In order to do this, we had to increase the deductible, increase the co-pays, increase a little bit, not a lot, but co-pays, and also on the pharmacy on this. What we did, and this was another suggestion by the union, was increase what the payment is for the emergency room up from $100 to $300. The reason why this was suggested is when we took a look at what our claims are, an above average number of people running to the emergency room rather than urgent care, rather than clinics such as they have at Walgreens, CVS, or just going to their doctor. So that drives the costs up significantly. So this will be a deterrent for those people who just want to run to the emergency room. And we've kept the out-of-pocket costs the same. So this takes it from 23 to 29 for the majority of our employees. The next, and this is something that I think PSTA has been behind the curve on, is I don't think we've ever offered a high deductible plan before. So this is kind of a historic moment here in doing this. We looked at it to make it free for single members. So today they're putting $23 of their paycheck aside for health care. Now it's going to go down to $0. We took a look at increasing the deductibles again, and we increased the out-of-pocket expenses. One thing that this is where education, as we'll talk about, comes important. If I were to take my $23 I pay today and I put it in a health savings account, pre-tax, by the end of the year, I will have accumulated essentially what the increase in the deductible is. So it's going to be an education process of saving money. There are a lot of folks here who already have an FSA. That FSA you usually set up at the beginning of the enrollment period. If they want to keep that, they may keep that. When that runs out, they can set up at any time an HSA account. And there's also other different types of FSAs that they can do in conjunction with it that will pay for vision, dental, and some medical expenses. So again, what we did here is go from $23 to $0. For the other areas, employee spouse, plus children, plus family, we kept it the same as what they're paying today.
Debbie, the second column on your chart says PSTA.
Those are the number of members, or employees, not members, employees that are in each of those categories. So we have 429 employees in the single member category.
Thank you. Thank you, Mr. Chair.
So for the first time, we're offering the 3 tiers of benefits, taking a look at what else can we do to help the employees. It's been brought up to us, a lot of employees might be interested in some gap insurance, which is something you've heard of Aflac on all the commercials with the duck, Colonial, things like that, that may be able to, for a small amount of money each month, cover it when we actually do have emergent situations that will cover that. One of the things that's interesting to know from a fact standpoint, when we talk about going to a high deductible plan, 85% of our employees had 0 deductible last year. 5% of them had between $1 and $750. So 90% of our employees we're below that 750 today current deductible plan. We only had a few people who actually met their out-of-pocket expenses. And again, that probably goes back to some of the extraordinary claims that we've had over the last 2 years.
So does the deductible, you have to spend $750 before you get any reimbursement for any reason?
Yeah. And on the high deductible plan, you'd go to the doctor, and today I go to the doctor and I pay $0 for my annual physical, let's say. And I don't know if it's still free on the HSA, but if I go to the doctor, I'm either paying $0 or $20 copay. If I go under the HSA plan, doctor says that's going to be, let's say, $150. If you've got pharmacy, we've got some people who are on, have a lot of medications, they may spend $1,500 deductible in the very first month. So then they'd be paying 20% beyond that. And if I say anything you need to jump in, I just jump in.
So does the deductible, you have, is that, you pay after you reach that $750 or that deductible?
Well, today under the current plan, I have a $750 deductible. Like I said, 90% of our employees, or 85% have never even, $0 have gone into that. If you use the example when Sean and I were talking, so I can understand it even better, is I go in an ambulance, I go to the hospital, I have inpatient doctors that are emergency doctors that are serving me. That's when those deductibles start kicking in. Otherwise, you're most likely never going to see the deductible.
Okay.
And I think maybe just to expand on that, if you have your sheet with the 3 plans, so if the employees, want to have that $29 contribution and they went to that plan that still has copays, as Debbie said, 85% of those people basically had below that $750 deductible, so they don't have that a very significant impact. If they go to the high deductible plan, everything is going to apply to that $1,500 deductible to start. So that'll really be the difference. That's where they get the cost savings in their payroll deduction if they want to set some of that money aside in the HRA.
Are you ready to take questions now, or do you want to keep going?
Let's see what we've got coming
Yeah.
up. So from a fiscal impact, we're looking at about $6.7 million for PSTA to be putting into this. As you recall, we started out with the lowest proposer at 32.6% increase. My goal was to try to get it down to about 20%. We've been able to do that by changing up the plans and providing the 3-tier structure. And I think we'll be comfortable right there, and it won't affect the budget that was already presented to you. And the biggest piece of this, because this is new to all of us here, I think a lot of us may have come from companies that offered options, but the majority have not, is going to be education. As I said, education. We're going to have not only Cigna people in here, but our own people. We have healthcare advocates that can work with people who choose to go into, and they help us now on any plan. So right now, if I need to go for an MRI, I honestly don't think about it. The doctor, I'll say, where do you want me to go? He might suggest someplace, and I just go. If you're in a high deductible plan, you're going to need to shop that. And we're not always as educated as we should be, so you pick up the phone, call the healthcare advocate, say this is what I need to have done. Where should I go with the lowest cost? Each individual member has their own story to tell. So we are going to have to work really with every single employee to figure out and help them decide what may be the best plan for them. And this is one of those years where there's no good answer, because it's always it's higher than it has been. So we're going to be looking at the HSA accounts. When people go through open enrollment this year, what I want to do is give them the paperwork to sign up for an HSA so that they can start keeping in that savings mode. If I'm paying $23 today, let me put that $23 into the account. It's theirs to keep rolling forward. Look at gap insurance, educate on that, looking at the benefits, and as I mentioned, we do have an advocacy service. We have embarked, as you know, on a wellness initiative because it's one of the areas, and also the union's been very helpful with that. we did something where we incentivized our employees to lose weight, because that helps with the chronic illnesses, helps with all kinds of wellness. And what we did is offered, if you lost 3% of your body weight, you got $100, 2%, $200, and 9%, 6%, $200, 9%, $300. Or if you came in at your BMI, you automatically got $300. What we found when I took a look at where have our costs been since we started doing that, our costs have gone down about 26% per month from where we started before we started the wellness initiative. We've also lost collectively about a little over 1,300 pounds, which is equivalent to an average American in the United States here, to 8 people that we've lost. So,
There's our fuel economy increase.
Well,
Marginally.
so it's been great. It's been fun. We're continuing. James has been our cheerleader on this and working with us. We've all been helping each other along to try to eat better. We've had wellness classes. We've learned what foods to eat, what exercises and stretches to do during the day. So if you walk past our group and you see us doing strange things, that's what we're doing. And on the good news side, albeit a small dollar amount, we've seen savings for our vision insurance, no increase in dental, and no increase with our Minnesota Life or AT&T. Now I'll entertain questions.
okay, questions? No questions? Oh,
I was
Mr.
going to
Schulman?
let other folks
Okay.
In no particular order of importance whatsoever.
Okay.
You said that you currently have an FSA. Do you know how many employees are currently using the FSA?
I do not off the top of my head, but I can get that
I
answer.
believe
for you.
it's about 100.
100?
100 to 120.
Okay.
Okay, and I'd be interested to know how many of those, what salary ranges those folks are in. What I'm trying to ascertain is how much of the income from our employees, the employees consider as disposable income for healthcare costs versus just a savings account to help pay for things. I do have a concern with the high deductible health plan, and not because high deductible health plans are inherently bad. I'm concerned that the employees won't save in the health savings account. They'll look at that as a $29 savings, and then will not seek care when they go to the doctor. And if it's a $150 bill, right, it's negotiated down, so they pay the negotiated rate. Maybe it's $80, but they'll instead opt not to go. In which case, illnesses can then increase and become even more costly. So, I know the idea was floated with the union to have the employees continue to pay the $29, but then have PSTA contribute $29 to a health savings account on their behalf. Any thoughts on that as an option?
I think the next couple of weeks, Michael and I will be going through the budget and getting it aligned up to present another draft budget. We can take a look at that point in time, see if we can come up with something to put in HSA.
Okay. And you mentioned gap insurance. What work has been done on investigating gap insurance?
I know I've looked at AFLAC to take a look at that, and they offer various different, options out there that people can go into. We had one of our union members say he has tried it in the past and he didn't feel it was worthwhile. Other members have come to us and said, we'd love to see it. Because it's voluntary, we can certainly offer that along with other carriers on that.
Yeah, and the one thing, one step that I would add in there is obviously, so with all of the voluntary product offerings that are out there, Aflac, Colonial, all those, they have to actually be designed in both a HSA compatible or a high deductible plan compatible mode and then non-compatible. So, one takeaway is obviously getting the direction from the board if we are going this route for sure before we go, so we actually put the right products in place, because the IRS says if you have that high deductible plan, basically you have to pay that deductible on everything first.
Mm-hmm.
So if you have an Aflac plan that jumps in there and then pays for that, it kind of violates the spirit of that. So they have an offering of both HSA compatible and non-HSA compatible. So obviously waiting on this direction is kind of that last piece to make sure that we're going that route before we put that in.
But has there been any work
and Sean, this might be for you. Looking at, different deductible out-of-pocket ranges coupled with a gap insurance to see if we can bring the cost down on the health insurance side and thereby help subsidize the cost on the gap insurance side, and then cover some of that initial out-of-pocket expenses
So,
for employees.
yeah, so let me just make sure I understand. The question kind of is, could we take the savings and buy is that what you're asking? Could we take the savings and buy the voluntary product for them? I want to make sure I understand it right.
Or potentially help subsidize the cost, not necessarily pay for it outright.
Yeah, so a couple things, obviously, one, because of the impact from a budget, we're trying to make Debbie not be mad at me by throwing any more additional costs on there. But I think the thing with the supplemental that we have seen, we work with about 100 municipalities across the state, and there's no supplemental plan that just comes in and pays your deductible. Right, they have all these provisions, so they may pay you a certain amount if you go into the hospital, a certain amount if you have a surgery, a certain amount if you go to the ER, and all these things. So it's this mixture of different benefits, but there's none that just says that you can do with an HSA that just says you spent $1,500 of your deductible, here's $500 to offset it. So with those offerings, if the one concern I think we would have is if you spent $20 for everybody that took that, the person that goes into the emergency room gets a $300 reimbursement. The person that just has to go to their doctor, they end up getting nothing. So how much money would PSTA spend in those programs, and what percentage of the population would it benefit? If you get a cancer policy, it benefits somebody that gets cancer, but you wouldn't want to pay for that for the population as a whole. So that would be the one concern and kind of one thing we would have to look at with the voluntary plans is there a product that really benefits the population as a whole and is worth that investment? Or the counter is, should we just take that money and put it into an HSA where they can use it for anything on the deductible?
Well, and that's a fair assessment. My concern is those employees that are under option 3 that would not be paying for their plan, not putting anything into an HSA, and then needing to go to an emergency room, or even just getting a colonoscopy or an X-ray because they hurt their hand, and then what do they do with a $200, $300, $400 bill?
Agreed.
That was unexpected.
Yeah, and that was ultimately when we met with the unions, and we did throw out the idea of kind of that forced savings alternative of what if we still charge you a payroll deduction, and then we put we're going to help you save, and we're going to put that $60 a month, maybe round it a little bit, into an HSA for you. That was and I'll let James or Larry or anyone that was in there, jump in if they want, but that was something that the union did push back. They said they preferred the $0 contribution. That was their feedback at the time, but it's definitely an option that we threw out because we understand that a lot of people, that savings, they're not going to save it, and that's a concern. And the first year could be the hardest because they might save it the second year when they have the bad experience the first year. But it's definitely a valid concern.
Yeah, most people get alarms for their homes after their home's been broken into.
Exactly.
Now it can happen to them. But the question I have, or what I wonder about is, and Debbie, you pointed this out, that 85% had zero deductible. 85% of employees had no deductible last year. So we're still, even at $1,500 for the deductible, we're paying a higher premium for still a high deductible but relatively low deductible still. Right? So could we raise that deductible, thereby decreasing our costs more so, knowing that 85% of our employees aren't even getting any part of that?
So that would apply obviously on that new alternate plan at the $29 contribution, but it's definitely something we can still look at to say if we bump this deductible even further, what is the overall cost reduction for that? We can take that away if that's the desire.
The other thought that I had with the increasing the deductibles, if we can get people in the education mode to save the money, as money in the high deductible plan increases, in a couple of years, and this to me is like a pilot program since we've never done it, is to look at it and say, well, now people are saving more and more into their HSAs. Now's the time where maybe we offer an even higher deductible plan. Because I'm sure there's plans out there that go up to $5,000 or $6,000, I'm not sure.
Oh, yeah, there are. And that's kind of my point, though, is that this first year, when changing to this, could be a very bad experience for some employees, you know, who happen to have a medical issue, who don't have something saved, who weren't necessarily, even if they were contributing, say, the $29, but, you know, a month in, they've only contributed $58, and they have an expense that's $3,000, $4,000, $5,000, $6,000 out of pocket. That's not a good experience. So I'm trying to find a way to encourage people to save into their HSA, bridge that gap on coverage so that they don't have as big of a negative experience should that medical event occur in these transition years. And it'll be less of an issue once people have built up their plans in the future. So I think there's some, and I realize that the gap insurance can only pay for you know, certain inpatient, certain outpatient sort of things, wouldn't cover normal doctor visits. But I think with the population and the experience thus far, that would actually work based on, you know, 85% not using their deductible and not necessarily needing those additional services. I will say separately from all that, I think increasing the ER visits from 100 to 300 is fantastic. If it comes with that education piece, because, you know, if the habit is to go to the ER, then it's going to be and someone signs up for the HSA plan, that's a very bad day.
Right.
And you guys will spend more time dealing with employee complaints, you know, 2, 3, 4, 5 months from now than you would normally expect. And then 2 other questions. The healthcare advocate, is that a PSTA employee or?
No, it's not. It's a firm that we've hired. It costs very, very little for us to have them on board. We have the posters everywhere, but I don't know if everybody's taken as much advantage of it as they could or should, to just pick up the phone and say, I'm going for this, tell me where's the least expensive place to go.
Okay, so it's not Cigna.
It's not, oh, it's separate from Cigna.
Perfect. And then the last question or thought was, have we looked into any, and I don't know if this would work, but an on-site clinic, something along those lines to cover those more routine, minor, with a nurse practitioner oversight from a physician?
You know, that is something we have really talked a lot about, to be able to have something on site. I've reached out to a couple places that have that. It doesn't necessarily reduce their overall costs, I'm finding out, but the employees love it. And I think they do get their care quicker if they can go on site. Where I came from, we had a nurse practitioner and a doctor that administered our drug and alcohol program, as well as being there. You know, if I'm susceptible to ear infection, so I'd go down there and say, you know, I'm not feeling well, and he could give me whatever script I need without ever having to leave the building. And what we found is they also did the 19A physicals. They were great at pre-employment physicals to be able to reach out to other doctors. So it kind of helped us on an overall basis. And that's something I'm very intrigued about looking into a lot further, to be able to put something on site.
Well,
or
and
close
for
by.
me, you know, cost is obviously important, but on the other side of that is employee care and making sure that employees are happy, healthy, they don't take more sick days. You know, an ear infection doesn't turn into a sinus infection, which turns into pneumonia, which turns into a hospital visit. You know, those sorts of things. By creating that environment where care is accessible. I also don't know if on the healthcare side, on the insurance side, if we have something like that, if that could be brought back to as a cost reduction measure.
Yeah, so a couple things I'd say on that. We have about 20 entities across the state that have their own health center. City of Clearwater is one. And, you know, there's tremendous value that's provided in that. Employee-wise, you guys, you know, typically we like to see about 1,000 is really a threshold to be able to get the return on investment. So you guys are around 600. However, we have a number of entities that have done partnerships and actually kind of pooled those resources, multiple entities coming together. That sometimes helps if you have multiple locations, because obviously your employees all work in predominantly one area, but they could live all over the place, so to get the spouses there. And that's something that's been tremendously successful. The one thing that really helps drive the success of that ultimately is being self-funded on the medical program, because right now if we redirect claims out of the medical plan to the health center, we're saving Cigna money, but we're, as PSTA, we would be paying twice for it.
Well, that's why I was asking, do we get a credit or reduction on the Cigna side for
Not as good as you would get it if you were taking the risk being self-funded on your own. We did in the RFP, just to touch on it real quick, we did look at, the potential of transitioning to self-funded. Right now, being that, Cigna offered a deal where essentially the costs are under what your claims alone have been on the prior 12 months. As Debbie and I have talked about it, we'd like to give it a little bit more time, even if it's potentially a mid-year transition down the road on the funding. You have a number of, if we look at your catastrophic claims, there's a couple buckets, but the biggest one really right now driving a lot of those costs up is cancer. So we'd like to see that, typically every group we work with every 5 to 6 years, they have 1 or 2 bad years, and I think you guys are in that. So we'd like to see that, hopefully come down a little bit before we look at taking that risk. But that's something that's definitely kind of strategic, long-term plan is looking at that, and that makes the option of doing a health center a little bit more feasible, because when you do invest that money in it and save it, that savings is coming right to PSTA and not going to Cigna or any other carrier in that case.
Is there a way for PSTA to and I just don't know, so on the self-insured side to purchase, catastrophic insurance?
Yeah, no,
cover?
so that would, everything we look at, we always include, looking at reinsurance costs and purchasing that. So that would definitely be a part of any program.
Okay. I appreciate the time.
Thank you.
Commissioner Scott?
Thank you, Mr. Chairman. I tell you, I like this approach a whole lot better than what we had considered last month, with PSTA picking up a big chunk of this and hoping that we were going to get a union concession down the road at some point. So we've had success with offering a 3-tiered approach like this. And it's been received well by our employees. What we found is that the majority of the people do go for the higher deductible plan. We'll get a few in the middle and then a few on the fully insured side. But I think this is a good way to go. I suspect there's a good chance actually that we could actually even come in a little bit below budget, depending on where that falls. And to Josh's point there, you're always going to have that. Well, I got this, I've got these big medical bills to pay, blah blah blah. You're always going to have a few of those that are going to happen in there. The big thing is just to make sure that the employees understand what they're doing on the front end. And there's always going to be a few people that get caught out. I mean, there's only so much you can do about that. But we've had good success with this. I think this is a good way to go forward for PSTA. And I would like to see if we could get, as we go down the road with this, sort of some regular updates as to where this has fallen, how the employees are receiving it, what plan are they choosing, and what sort of feedback we're getting from that. But I think this is a good way to go, and I certainly support it. So, thank you.
Mr. Johnson?
Thank you, Mr. Chairman. So just let me summarize here a little bit. We're going to be offering 3 options to the employees.
Correct.
Okay, which are in this one big table that was here. And because the existing plan was in the union contract, can we deviate from the union contract to offer these 3 plans? And how does that work?
We would have to do an amendment or a side agreement on this, a non-binding agreement to move forward on this. And
So
Although,
that would be our
that's part
intent.
of our negotiation discussion is, if we abide by the contract, they're gonna pay $77 a paycheck.
Right.
This is all good for them.
Okay.
Not that they're totally appreciating that as much as Brian pointed out as we'd like, but we're not gonna amend the contract, at least.
No, there's no plans. If it's, if it's in their benefit, it's not an issue. And we kind of joked about that when I met with the union yesterday and a couple of weeks ago. If it's something better than what they're getting, it tends not to be an issue. But I have been asked, and I met with the union about this yesterday, to kind of put something in writing, an MOU, if you will, that makes it clear that between the company and the union, we will continue to work and have a discussion on how we improve the insurance and keep costs low for our employees. Because this is an exercise we do each year. So the question that came up yesterday from the union was, where is it 5 years from now, 10 years from now, that type of thing. So there were some ideas that they had yesterday, which included a lot of things that you said as well, that I think we're going to put in a memorandum and we're going to work on all during the year. So they're interested in really though working to improve this and keep costs low every year.
Okay, thank you, Mr. Chairman.
Any other questions? I just have a quick question, and I'm not an expert in this area by any stretch of the imagination, but the individual employee would move from $29 to $0 by going to the higher deductible, but the differential for employee and spouse, employee with children, employee and family are very, very minimal. So what would be the rationale for someone in those three categories to move to the high deductible plan? I don't
They
quite follow
don't,
that
well,
one.
and today, I think you've got a valid point. You know, today they're paying the same amount today as they will be tomorrow. Again, goes to how much can they set aside, how much is listening to the board today, the recommendation of what can we do to help the employee to set aside for savings in there, but right now it doesn't change what's coming out of their pocket today.
Mr. Chair, to your point, I mean, we've discussed that. The action item really today, the contract that we have to have approved is the contract with Cigna. The policies that we place, put in place about how much the employee pays or how much the family and the employee plus child and all that is not necessarily impacted by the Cigna contract. It certainly has to be included in our budget. So as Debbie and Sean have said, what you pointed out, we recognize. I mean, as you see, the vast majority of employees, and that's what we've been focusing on, and that's what the union focuses on, is the employee only, the 429. But you're right. I don't see there's really hardly any benefit to any family, any of the 130 families switching over to the HSA, the way we've priced this out. And so we're going to take a look at that. We're also going to scour the budget and see if we can maybe come up with enough money that we might be able to actually put some money into the HSAs. I think if we do nothing, which is certainly a possibility, this will save us, this will bring us within budget, this will give people an option, but only the very healthy millennials, single millennials will move over there, and most of them will probably migrate to option 2. We stayed kind of the same. If we come up with maybe some incentives, like you've been talking about, over the next month or so, and then I think we can start driving a few more, over time we'll drive more and more people to the HSA, which I believe, and I think Sean, you would agree, when you talk about 5 years, the long-term trend is option 3 is the most long-term, the way in that PSTA and the employees will save the most money. If we can come up with a package that the employees are getting their care, and that, but we ultimately end with more and more people moving to option 3. We're probably not going to get there in year 1, I don't think. But
All right, now, let me ask one other question, and that is, should we're in a small group here, and it took a long time to go over this category. But on the other hand, if we move this to go into the category of pre-approval, then we're not going to, somebody's probably going to want to pull it back out. So I would assume this item would probably want to go into the regular program. Is that correct? I would assume, yeah. Okay.
and we do.
And by the way, Sean and Deb, thank you very much. I mean, this is the hard stuff to present, and we're not experts in the field, and so this is really a hard thing to get across to lay people. And thanks very much for doing a great job of putting together a good program that really will help PSTA employees and help us attract new employees down the line. So thank you very much. Okay, do we need an approval on this? Yes. Okay. Do I hear a motion? I move approval.
I'll support.
Okay, good.
I have a question about the motion.
Yes.
Is the motion to approve the contract with Cigna, but not necessarily the benefit levels?
Yes.
Is that what we're talking about?
Because they're still fine tuning that, correct, Brad?
Yeah.
Mhm.
It's actually Cigna.
Yes.
Cigna, Advantica, and Minnesota Life.
Okay, so but this is just approving the contract to move forward with those companies, but not necessarily with the plans as outlined in the different options.
Correct.
Okay.
Still tweak on that.
Yeah, I mean, we're still.
I just wanted to make sure that I knew what I was voting on.
Yeah,
Yeah.
okay.
Why are they, how are they not connected at the hip?
So
They're
the,
connected to the hip, but
well, I think, so procedurally, I'll defer. So the rates that Cigna gives you, ultimately, the contribution that you all choose to set as PSTA and as the board is, they're not concerned if you make employee 0 or if you make employee 50 and put it into the HSA, that does not affect their overall rates. If we were to change the actual schedule of benefits, higher deductibles or anything, that would affect the rates. So I'll defer to Debbie and Brad on whether or not.
Yeah, and one of the things that's different with this, we've done this for 5 years, but at 1-year increments. Because even though in the past we've come to the board every year with this, we had a 5-year agreement, so we'll be actually terminating it a little bit early. The point is, we want to be able to look at this and evaluate it, come back with perhaps different options in the following year. We could go, as Sean said, if things keep improving, we could go self-insured partially through the year. So I want to be able to bring this back to you every single year for discussion.
And this is to approve not to exceed 8.35 million.
Right,
So
for just this
if
1 year.
changing deductibles or moving some things around or, after the fact, but in the next month or so, decreases that cost, then that's,
Right, and it'll be
that's still
probably in the
fine.
next couple of weeks, because we usually do open enrollment in August.
Yeah, and I do need to say, with open enrollment coming up, and there's a ton of education we have to do, both myself, I'll be out there, Gary and Cigna. That's gonna happen in August. I've had these discussions with the union in the days leading up. We have to start taking these contributions in September for them to go into effect October. Met with the union yesterday, and what I thought was a final closed down meeting for the contributions as are set. Anything that will increase, for example, we go to look at increasing the high deductible health plan, for example. I've already given them the numbers as set, so my challenge would be in front of me to go back to them and say that we've increased the deductible for like a high deductible health plan. So not that it can't be done, I'm just saying I've already discussed with collective bargaining employees what we're looking at. Anything to improve, of course, will be welcome.
Okay.
Thank you for the clarification.
All right, so we have a motion and a second with the understanding that this is going to be on the main
action.
action committee,
For the
action items for next week, okay? All in favor?
Aye.
All opposed? None? All right, passes unanimously. Again, thank both of you for doing a great job of making a complicated issue reasonably understandable.
It was an entire team of PSTA people along with the union, so it takes a village here to get it.
Okay. All right, the next item is reports, monthly financial statement, monthly reports.
All right. Well, we're up through the month of May, and if you take a look at the monthly report, I know we love to look at year-to-date because that kind of tells us, but if you look at the month, for the first time this year, I'm excited to say passenger fare revenue is 8.3% above budget, so that is excellent, excellent news. When we take a look at the month as a whole, we had budgeted a deficit of 3.1 million. We're coming in at 2.9 for a favorable variance of $153,000. So passenger fares was excellent. I think we'll be seeing that again for the month of June when we offered the 50% off the monthly pass. That was very successful. We have to see how it falls out in the following month. I want to see if Michael bought them all and is going to sell them on the black market.
During the month of June, we did a half-price sale on the monthly pass. So instead of $70 for the month, it was only $35. And at least tentatively, the number of passes sold compared to the previous June was up like 6 times as many. And we made more money. We made more money on the $35 sales than we did on the previous year's $70 sales. A lot more money on that. But we're holding off on, we're gonna see, maybe everyone bought their like 10 passes, and so we're gonna see a huge drop in July. I don't know.
Yeah.
We're gonna wait a couple months to see how it shakes out, but we think it was a good experiment.
Good.
Do we know, if were those individual riders buying, or were they resellers buying?
It wasn't our resellers, it was individuals.
Okay, that's good.
We had a rule, we had a provision that you could only buy one per transaction.
Okay.
To try to
Go
mitigate.
back
Yeah,
and
right.
forth
Yeah.
That's
between
good,
a
that's
few
good.
times, but-
All right. Any other questions? Basically, when do we get to the point in the year where the issue that we ran into last year with the way in which the different passes were being sold by who was selling it? The
The
county?
county
County Health Department?
Yeah.
Yeah.
So when will we get to the point where that sort of blip in their radar is over and we should be on a regular system?
I think we're there
Okay.
now. Knock on wood. January 1st, we transitioned the program to a stable new program, and we just met with Pinellas County Health and Human Services folks, and they're very pleased, and they're recommending to the county in their budget process renewal with an increase for next year.
Okay. Good.
So we're okay with that.
All right. Okay. Any questions, any other questions on this? Okay. All right. So next is ridership.
Ridership report is for the month of June is at your places, and well, suffice it to say, we had a lot of rain in June. I would attribute most of the decline to that. On the regular route, unfortunately, DART ridership is skyrocketing. It's going up quite a bit. That's for people with disabilities.
Mm-hmm.
That ridership is increasing, and we pay for every ride. We pay more the more people ride. For the regular bus, we don't pay any more whether people go ride or not. So that's somewhat of a challenge, but like I said, we had some positive feedback, positive results, I think, on the half-price sale. Most of the decline, a lot of this decline, as you can see, is the Jolly Trolley and a little bit on the Looper. But those are substantially down from a year ago. But that's again largely due to the service that goes to the Clearwater Marine Aquarium on the Jolly Trolley. That is way down, and it was because it was way up last year, tied to the movie.
Mm-hmm.
And Clearwater Marine Aquarium is transitioning, so they're going to completely eliminate the service. They're moving the displays related to the movie from downtown Clearwater to their own place, and they're building a parking garage there. And when those are done, then they will no longer have that shuttle.
Mm-hmm.
But we try to put that on the bottom. The planning staff kind of analyzes it and assesses. This is just an educated guess, of course, but it sort of allocates different issues that may come up during the month and what relative impact they may have.
Okay. Any other questions? With regard to the variation on the Jolly Trolley and Looper and all those kinds of tourist-related things, is there a reduction in tourist traffic, from Camp International or anything like that correlates to that, or
I think
that's
Sandra, you
okay?
told me that you got some information that Clearwater Marine Aquarium attendance was down.
Significantly, yes, and they've opened their parking garage.
Right.
So,
But overall tourist traffic is about the same, or?
tourist traffic was down a little bit this season, and it was also spread out. So the spring break in general was a little bit more elongated. So.
Okay. All right. So what I'm getting at is we don't have to make any adjustments to schedules or projections or anything like that at this point. These are sort of small anomalies that we're seeing.
Yeah, I mean, we are going to have to make the adjustment once the Jolly Trolley no longer services the Clearwater Marine Aquarium.
Right.
When that.
Okay. So that'll be within the next year or two?
It will be a while before they get their build-out completed on Island Estates and totally move the exhibit from downtown Clearwater. I think it's going to be 18 months before we see that.
Okay. All right.
That totally happened.
Okay.
I think that I saw some statistics on hotel use occupancy, and it was down maybe a little bit, 2% or something like that. But they also reported that their, and I forget the exact term, per available room revenue average rate was still up. It was, so they were happy, even though they had just a little bit less number of people there. Yeah.
People are paying more even though they're less of them. Fewer people. Yeah. Okay. Okay. So they were about even. Okay. Fine.
It's okay for them.
All right. And lastly, then, is contracts.
So once a quarter, every 3 months, we present to you a listing, so you can look at home, so you have this all memorized, of every contract the PSTA has. It ranked by order of value. And you can see we had a nice, healthy, robust discussion on the health insurance, and with good intent because it's ranked number 3. It's the third most valuable, and that's just 1 year. As we just discussed, it's $8 million a year. So the Care Ride contract, which is number 1 at $36 million, that's over 5. So let's see, 8 times 5. The health insurance is the number. Health insurance, Cigna, is getting the most money from us of anybody.
Per year.
Yeah. Same thing on the number 2 with fuel. That's a multi-year contract.
And that's not 5 million, it's about to be 6.7 million.
Right.
Correct.
Right.
Yeah, that's just our share that's listed here. Not the employee contribution.
Oh, right.
All right.
Sure.
Yes, go ahead.
The
Commissioner
HART
Johnson.
Regional Interjurisdictional Mobility Project, is that the fair
Yeah.
card thing? Okay.
All right. Any other questions? One question I have is, are there any contracts that we need to kind of really study and pay more attention to because they're behind or anything like that? Or-
Next month, we will present we have a cycle of reports that we provide to the Finance Committee. We provide this every quarter, and then next month you'll get your quarterly progress report on all the capital projects, and that lists every project in our CIP. And generally, we're doing pretty well as far as keeping on schedule. But that shows the progress for each. I mean, really, I think this PSA contracts, the value of this report to you from time to time, at least when it was created, I think I would attribute it to Neil Brickfield when he was on this committee, was a way that you could look down and make sure that you saw some entity that you were related to, you would know when you might have a conflict or something like that. Just to know who we're contracting with and keep track of all the different entities, not just for board members, for everybody.
All right. Future schedule, anything particularly that needs to be put into meetings in the near term?
Well, I'm sure this committee will be excited, but next month we plan to have a nice, robust discussion on the buses we're going to buy.
All right. That might be a good one. All right.
I'd rather talk about healthcare.
I'll take those.
All right.
And that's why we're here.
Okay, if that's it, then thanks very much, and we ended 10 minutes early, so that's pretty good. Meeting adjourned.
Well, how was it?
Oh, it's okay.
Yeah, my only
I'd like to have something.
concern is just,
Okay.
we're coming, we get late.
I'll let you know.
So should I ask
Well,
her to send
the thing is, I
something
mean,
in the mail?
it's kind of like,
Oh, the single-
Well, I'm concerned.
our job is
Which is
to
better?